Yeah. Yeah. Well, there's heaps of options. And so I think that's probably the most important point. Surgery is one option. And there'd be a very, very strong research argument that it's the last option. It's never off the table. But all too often, I think the patients assume it's their only option. And if you look at statistics and if you look at the healthcare systems and if you look at what's happening in reality, as you said, I guess, in the court of public opinion, the patients believe that. And so that's not true. And that's the first key thing is they've got options. So patients can have early surgery. So they could, after the injury, essentially get it done within a matter of hours if they wanted to. But, you know, it's typically within if they're wanting that pathway and they're committed to that, they could get it within a number of weeks or days or weeks. You can do a period of prehabilitation where you're allowing the joint to settle down, getting the knee range of motion full, getting your walking pattern more normalized, helping to trust your knee a bit more, getting it stronger. You can do a strengthening and conditioning program overseen by an experienced and trained physiotherapist with the option of surgery if your knee is unstable. You can do a bracing protocol, which is, there's a few out there. In fact, we've known since the mid-1990s that you can brace the knee and increase the likelihood of healing. And you can also choose to adapt, which is this concept of deciding within yourself that, look, it's probably too risky given my goals and stage of life or where I see myself in the context of this injury. You can choose to not go back to high-level pivoting, which is one of the ones I think is often missed and not discussed with patients, because most of the patients I see, Brad, are general population, and a lot of them aren't so fussed whether they go back to a change of direction level one sport like soccer, rugby, AFL, netball. They just want to be able to play with their kids, keep active, run, trail run, ski maybe, play some tennis, which is a bit different. It's a different level and lower risk. And I think that's part of the conversation which should emerge more. G'day, it's Dr. Kieran Richardson, specialist physiotherapist and the director of Global Specialist Physiotherapy. I'm very excited to be speaking to Brad Beer from Pogo Physiotherapy on the Physical Performance Podcast.